Welcome back. Well, February is Heart Awareness Month, and Prime Pediatrics and Adolescents in Flint is joining us this morning in this sponsored segment to highlight pediatric heart health through a local family's story. We say good morning to pediatrician Dr. Ali, and she's the owner of Prime Pediatrics and Adolescents, as well as Morgan Birchmeyer, mother to Cash and Lil. We've just became best friends, right, you guys? Good morning, everyone. Thanks for being here. First of all, doctor, why is pediatric heart health so important to talk about?
So unfortunately, it's one of those conditions which is congenital heart disease. 1 in 100 kids normally have that condition. And it is very important that the parents, they seek timely prenatal ultrasound so we can diagnose these conditions. Unfortunately, as adults, we can tell when we are having symptoms, while in children, it's very difficult for them to express if they're having any kind of heart problems. So congenital heart disease is basically a birth defect, which is a structural abnormality that the kids are born with.
Okay, so these prenatal ultrasounds are very important, as are visits to the pediatrician. Now, what are some warning signs parents should watch out for?
So most of the times they will have lethargic kids, shortness of breath, difficulty while feeding, failure to thrive. They'll notice some bluish discoloration around their lips. So it's, again, very important not only to seek prenatal care, but at the same time, the timely well child exams also.
Right. And Morgan, tell us about Cashton and his condition, and when you kind of knew something just wasn't right.
I actually found out at my 12-week ultrasound. I had no clue it was a test. And they told me it was either going to be Down syndrome or a heart defect. So then when I went to his 20-week scan, they checked his heart, and it came back as truncus arteriosus.
And yet, what exactly is that?
So he was missing a valve.
Okay. Okay, now what would you say to parents, doctor, facing that type of diagnosis? I'm sure that had to have been a really scary moment for you. And he looks really active and healthy, happy as ever. And that's amazing. Yes.
So truncus arteriosus is a very, very rare condition. And when Morgan came to me, and she was in tears, literally, because Lily was already a patient, and when she came to me, so truncus arteriosus, normally in a heart, you have to understand there are 2 main vessels which are going out. In this little guy's case, it was 1 vessel which was coming out of the heart. So that just causes a lot of problem, and it needed immediate surgical intervention.
And what would you both say about telling parents how important it is to trust your gut instinct?
I think there's a picture right there. Yes. So Morgan would actually be able to kind of, say the best words for the parents, for the new moms who get this diagnosis.
Yeah, what would you say to parents?
It's a very scary condition.
Yeah. I mean, when I found out, it was challenging, but I just knew that he was going to be fixable and everything was going to be okay. And I mean, look at him. He's got a life to live. He's crazy. He's wild. He's excelling in school. He plays t-ball, and
he's got his crazy dance. You want us to show your crazy
and
dance?
And Lil wants to say something about her brother, I think. What do you have to say? Is he pretty active?
He's really crazy.
Well, that's a good thing. Now, doctor, where can people go for more information?
So basically, I would just recommend very strongly following up with your OBGYN for timely ultrasounds. Like Morgan said, 18 to 22 weeks is when we normally first diagnose them. And then after that, basically following up with your pediatricians for regular well child exams. So in case if something did fall through the cracks, then at least we can get them diagnosed early.
Oh, great information, you guys. We are out of time. Thank you for sharing your story and all of these valuable resources.
Thank you for having us.
Yes,
Thank you so much.
Thanks, Lil and Cashton.